Good morning. I'm Kimberly Bishop, Associate State Director at AARP Michigan, and I'd like to welcome you to our first Learn a Latte event for 2021. One of the reasons that we call these sessions Learn a Latte is because we'd like our viewers to join us with their morning cup of coffee or tea to hear about topics of interest to those 50 and older and their loved ones. These sessions will be held each month on the first and third Wednesdays at 10 o'clock. Learn a Latte is just one of the virtual events planned for 2021. Please visit our webpage at aarp.org/Michigan and click the link for virtual events to see what's coming up. The page is updated frequently, so please bookmark it and visit it often. Today's topic is staying safe and independent at home. Our research shows that the overwhelming majority, 89% of Michigan residents, prefer to age in place, which means staying in their own homes and communities. You'll hear about some home and community-based services which can be life-changing to older adults and their families. I'd like to introduce Lori Janiga, who is our guest this morning. Lori has worked with older adults and adults with disabilities for 14 years. Lori started her public service with Jackson County Department on Aging, where she was the Nutrition Services Manager. This leadership role included facilitating the Home Delivered Meals Program and activities programs. For the past 4 years, Lori has worked at the Region 2 Area Agency on Aging. Lori is the My Choice Waiver Manager and provides oversight to Region 2's intake department. Lori has vast experience assuring participants in Hillsdale, Jackson, and Lenawee counties that are served by the AAA. Lori has a master's degree in counseling and has been a supportive advocate and leader throughout her career. Welcome, Lori, and thank you so much for spending time with us this morning.
Thank you for having me.
Oh, you're welcome. You're welcome. This is an interactive program for our viewers, and viewers may ask questions by posting them in the comments section. I do want to note that we're not able to answer questions about very specific circumstances, but we'll do our best to provide you with information about the resources that are available. Before we get started, because I know I'm guilty of it, can you tell us briefly what the acronym AAA is as it relates to older adults?
Sure. AAA stands for Area Agency on Aging. All counties in Michigan have a AAA in their county or that serves their county. And AAAs are experts on all areas of aging and adults with disabilities. And we help caregivers and folks, aging individuals with information and resources. And we also have a lot of programming that we provide.
So even though you happen to work for the Region 2 AAA, which is Jackson, Lenawee, and Hillsdale, if you provide some information, people who are watching can contact their local AAA to find out about the programs in their area as well. Is that correct?
Correct. All AAAs run a little differently, and they all offer different programming, but a lot of it's similar as well. And one thing's for sure is they are experts on what resources are available in your area. So most of them will help you find the answer if you can't find it yourself.
Perfect. Well, Lori, I know there are two major programs in Michigan that help older adults stay at home and independent longer, the My Choice Waiver program and PACE. Can you tell us a little bit about the two programs, the services that are offered, and the difference between the two?
Sure. The PACE programs and My Choice Waiver both have the same mission, and that is to put supports in place so that you can stay in the home of your choice. The main difference probably between the two is that with PACE, PACE has their own network of doctors that you use. With Waiver, you use your current doctors. Also, PACE has not all counties have a PACE center, but if you're lucky enough to have a PACE center in your county, they have it's a very lively, active center where they provide meals and activities and exercise. And part of the PACE program would be that you go to the PACE center at least once a month, but some folks I think choose to go daily, and PACE provides transportation to the center. My Choice Waiver does not have that, and but My Choice Waiver would provide socialization opportunities, like maybe a ride to a senior center so you can get the socialization. So there's a little difference between the two. You can't be on both at the same time. You have to choose. But if you're lucky enough to have both opportunities in your area, you should investigate both of them if it's something that you think would help you to stay at your own home.
I know that the focus really is on home and community-based services. Does My Choice Waiver help with rent if someone's in assisted living?
My Choice Waiver cannot pay for rent or room and board. However, if somebody is moving to an assisted living facility or currently resides in an assisted living facility, depending on what their needs are, if the standard room and board doesn't meet all the above and beyond care they need, that's where My Choice can help. Let's say somebody's incontinent and needs 4 or 5 showers a week, but the room and board contract only pays for 1 or 2 showers a week to have a nurse assist or a caregiver assist. That's where My Choice can step in and help, where they can pay for the above and beyond care that might be needed. That's just one example of the above and beyond care that could be paid for by the My Choice program.
So can you tell us the difference between assisted living and skilled nursing so that we really understand where these services are provided and how?
Skilled nursing is usually ordered by a doctor. Most commonly, it's ordered when you're leaving the hospital to go home with temporary services. It's like, when you're in the hospital for a week or two, you need to build your strength back up, or you might need some med management when you get home. So a doctor, the hospital doctor, or your own primary care physician may order skilled care to come in for a certain number of weeks. It's not a permanent solution. My Choice Waiver and PACE are long-term solutions for long-term care at home. That's the main difference.
Oh, great. Thank you. I have a question about how do people qualify for the My Choice program?
Okay, the My Choice, first of all, you have to be 65 or over, or 65 and under, and deemed disabled. There's 3 ways that you qualify other than that: financially, medically, and you have to have a service need. So financially, your income for 2021 would have to be under $2,382, and that's any income you have. So that would include pensions, Social Security, maybe VA money, and then your assets have to be less than $2,000. That does not include your home and your car. So that means in your bank account or your 401ks. But this can get real intricate and tricky, especially for a married couple. So I highly recommend, if somebody is wondering if they qualify for My Choice or if their loved one qualifies, to call your local AAA and find out. Okay. And then the second way you qualify is medically. You have to be at we call it the nursing facility level of care. And that means that your medical criteria would qualify for you to live in a nursing home. But you don't want to live in a nursing home. You want to live in your own home. Mm-hmm. So that's the second way you would qualify. You have to be at that level of care where you would need a nursing home, but we're going to put supports in around you so you don't have to stay in the nursing home. You can stay in your own home. And then the third thing is you have to have a service need. And what that means is like you need help with your activities of daily living. Like you need help transferring from your bed to your chair, or you need help with a shower, or there's many different service needs that will qualify you, but you definitely have to have a service need.
So you mentioned the term activities of daily living. Can you tell us what that means?
Sure, that is anything that someone does in their daily life, just like we take for granted. When you're younger and healthy, you just take it for granted, like getting out of bed. That would be an activity of daily living. Being able to eat or prepare food, getting into the shower, and being able to bathe yourself. Those are some examples. There's probably a few more that I'm not thinking of right now, but
no, that's okay. That's okay, because I know sometimes we use terms that mean something to us in our lines of work, but people don't necessarily, our viewers might not necessarily know what that means. Being able to feed yourself or prepare meals, those are really important things. Whether you're able to care for yourself, bathe, comb your hair, brush your teeth, those kinds of things. So those are also included in activities of daily living, aren't they?
yes.
Okay. Are there other options for in-home services for people who don't qualify for the My Choice Waiver program?
Yes, there are. There's a program through MDHHS called Adult Home Help, and that's for folks who are on Medicaid. And you can get a caregiver through Adult Home Help. There's also every county is built a little differently, but most counties have programs through ASA, which is Adult and Aging Services. And they are ASA funded, and we have one here as a matter of fact. It's called our tiered care program. So to qualify, you just have to be over 60, and you might qualify for someone to help you take a bath, or you might qualify for a little bit of housekeeping every week. So if you're questioning that, and that's all you need, if you don't qualify for a waiver because you're not at the nursing facility level of care, it'd be a great idea to call your AAA to find out what programs are in my area where I could get, just all I need is somebody to help me clean. I can't clean anymore. I have a bad back, or I need somebody that could help me take a shower. Call your AAA in your area, because that's where you would find out if you would qualify.
So I'm just curious, are family members allowed to be those paid caregivers, or are there services? How would somebody find those in-home services for things like chores and bathing and meal prep and those kinds of things?
That's also dependent on the county that you're in.
Okay.
In our local area, our Department on Agings have workers. They have employees who do the home care work. I know if you're on Adult Home Help through MDHHS, you can hire a family caregiver for that. Also in the My Choice Waiver program, there's a self-determination program where you can hire, you can decide who your workers are going to be. So a lot of different options.
So how do these programs work with Medicare? Does Medicare pay for some of the costs?
Well, to be on My Choice Waiver, you have to be dual eligible. So you have to have Medicare, and your Medicare still pays for, I'm sorry, My Choice Waiver is the payer of last resort. So Medicare is always billed first, and then what's not covered by Medicare may be covered by your My Choice Waiver.
Okay, and I'd like to remind our viewers that if you have a question, you can put it in the comments section so that we can ask Lori the question. So Lori, are you finding that your demand or request for services has increased during the pandemic?
I would say that in some ways we have a very robust intake department, information and referral department. And so we've gotten a lot of new kinds of phone calls, people that need help with, they don't want to leave because they're home because of the pandemic. So they need help with getting groceries, or they need help, they need a mask. It could be something as simple as, I don't have any dog food. And most AAAs have a very helpful INR department intake and referral department that can help you with those things. And you should definitely call if you have questions about that. But that's the way that we've seen an increase is just in different kinds of needs and more phone calls in that way. As far as our programming for like My Choice Waiver, it's always a steady influx of folks that need help. I mean, we always have a small wait list. It's not a real long one. Some counties have a year-long wait list. So we're lucky in our counties that our wait lists are pretty short.
So are you still providing, how are people getting access to the services of at least your AAA? Are you still open or are things virtual? How have you adapted to keep older adults and your staff safe during the pandemic?
Yeah, we have stayed open throughout the whole pandemic. Our office is not open to visitors, but we have, and most of our staff is working from home now, like a lot of companies. But our phones have never stopped. I mean, you can always call us, email us, text us. And as far as in-home services, we followed the guidelines from CDC and MDHHS. And so our social workers and nurses who usually would go into homes and do intakes for our programming, they do everything over the phone right now until we are given the green light to start going back into homes again. Because the folks we serve are the most vulnerable, and we don't have any chance of bringing the coronavirus into their homes. So we limit that, but they still have caregivers because caregivers are essential. These folks need to have somebody to help them with their activities of daily living. I'm going to say that word again, with their baths, with their groceries, with just, going to the bathroom. So they have been essential, and we have not stopped providing that. If the participant wants their caregivers in, they've been in.
And they're obviously following the CDC guidelines.
Absolutely. Masking up and gowns and the whole thing. Yes.
So I know for AARP, obviously we're doing all of our events virtually because we too are concerned about doing our part to slow the spread of COVID by social distancing. So our offices are not open either. We're working remotely and bringing a lot more programming, which has been a really good opportunity because now we can talk to people statewide about things that maybe we were only able to do to a smaller audience in person. So, I'm trying to find the positive in this. Are there other thoughts that you have about, or, for a family caregiver who just, doesn't know what services are available to them?
Yeah, I really highly recommend calling your AAA, your local area agency on aging. That could be a big help. A lot of folks also have 211 phone lines in their area, and that's another great resource when you're looking for resources to help you. And I think most AAAs also offer a lot of caregiver classes and a lot of support to caregivers. So it's a good idea to check out their websites and see if there's so many virtual classes available right now. It's wonderful. I mean, like you said, you have to look at the silver lining, and I think that our virtual classes have really grown. And I think it was hard at first because people are afraid, like, I don't know how to use that technology, but I mean, like we help people and we guide them through it and train them and do whatever we can to help them use the technology because we want to keep people connected.
Can you tell us about some of the programs that your AAA is offering?
Sure. One of the new programs that we're offering during the pandemic is we have a friendly reassurance program. You can get registered for our program, and then we have friendly listeners that will call you once a week or once every other week and check in on you and see how you're doing. That's been a great program. It took off. We started, I think, last June, and it's just grown and grown. We're always looking for more volunteers to be friendly listeners. What we've heard from them is that it's therapeutic for them as well, just to be able to be a good listener for somebody. We have a lot of community education, a lot of classes. We have like a matter of balance classes, caregiver classes, as I said. We have a lot of, I mentioned earlier, our tiered care program, and that is through the Adult and Aging Services. And that program has at the tier 1, the lowest level is you get a phone call every month from a nurse or a community health worker to check on you and see what resources you may need. And then tier 2, you may have home care, you might have someone to come and help with the bath. And then tier 3 is even more intensive, where you have a nurse visit every month. So those are some of our programs. We also have a very robust assistive technology program. And assistive technology is if you have Parkinson's and you can't eat because you shake too much, we have a wonderful staff member here, Glenn Ashlock, who will do an assessment with you and figure out what you need help with. And he might be able to find a spoon that has a counterweight in it, so that you can eat your soup still without spilling it. And it's a great program, our assistive technology program. There's a lot of really cool devices that you wouldn't even know existed. It could be technology like a tablet, or it could be something to help you put your socks on. So it's a great program.
You really kind of queued us up, because we actually do have Glenn on an upcoming show, and we've had him before, and he is just so wonderful, giving information about things I might not have thought about, or ways to use things in different ways. And I really love the fact that he started out, the first time I met him, talking about assistive technology. He said, you wear eyeglasses, they help you see better, so that people don't have a negative stigma about assistive technology, because we want to enable people to be independent and safe, for as long as they can be in their homes. And that's definitely another thing that helps. And I'll say that program might be something that's really unique to your AAA, because I've not seen or heard about it in other areas. So I'm hoping our viewers will join in for that one as well, to get those ideas if they don't live in your service area.
Right.
So
I'm sorry.
No,
I was going
go
to
ahead.
tell you something. We also have a safe haven program that helps with folks who are being exploited or abused. And we provide care if somebody needs to get out of the unsafe environment they're living in. We'll provide housing for them, temporary housing, until we can find them permanent housing, and any needs that they may have while they're in our temporary housing, to help them get into a safe situation. So that we work very closely with Adult Protective Services in our area. And that's another program that's newer for our agency. I think it's in its 3rd year right now, but it's been very rewarding to be able to help people in such a vulnerable position. So,
have you seen incidents or needs for those kinds of programs rising as people are safer at home and spending more time at home together, and losing jobs and a number of things that may be adding stress to a family unit? Have you noticed an increase in the need for that program?
I think it's been pretty steady, the numbers. I don't know if I would say an increase. I think the increase that we've noticed is homelessness and housing issues, and trying to find housing. It's been a problem. And I know, while it's been great that people wouldn't get evicted for a long time, it also caused not having the turnover in housing where there's openings for people to move in. So that's been a big challenge, is housing. And I'm in our area, we have had some new housing developments opening very recently. So that's been wonderful, but I know it's a problem all across the state.
Very true.
Mm-hmm.
So if someone is experiencing homelessness or soon to be homeless, who would they contact?
I would recommend, first and foremost, Community Action Agency.
Okay.
Mm-hmm.
Okay. So as we are winding down to a close, Lori, thank you so much for being here with us and sharing so much information. I know that the Region 2 AAA has been such a great partner for us, especially with this Learn a Latte, and even, prior to the pandemic, when we did things in person, just a really great organization to work with. So I really appreciate you being here, sharing such important information. And I look forward to working with you more in the future. But before we close, is there a final thought that you'd like to leave our viewers with today?
Sure. I think the most important thing is, if you are struggling in any area and you need help and you're not sure where to turn, call your local AAA, because your local area agency on aging, because they may be able to point you. They might not be able to solve your problem, but they certainly will be able to point you in the right direction to of resources that could help.
Okay, well, again, thank you all. I'd like to thank our viewers for joining us today. I'd also like to remind you to visit our webpage at arp.org/Michigan to see all of our upcoming events. So I'd like to thank you again, Lori, and I'd like to thank our viewers, and I'd like to thank our volunteers who are helping us behind the scenes today. And I'd like to wish everyone a wonderful Wednesday.